Level 1 trauma centers are a rare breed. At last count, there were only 220 in the U.S., with just one in Central Florida. That happens to be right here at Orlando Health. Joining us now is Dr. Tracy Zito, Orlando Health Trauma Medical Director. Thanks so much for being here with us today.
Thank you for having me.
So we are at Orlando Regional Medical Center, and this is a Level 1 trauma center. It's different than a regular trauma center. You have a 25% reduced risk of death if you're treated at a Level 1 facility. Why does it make such a big difference?
So Level 1 trauma centers have to have the highest level of readiness, capability, resources. They must provide all the subspecialty care. They must have 24-hour a day, 7-day a week CAT scanners, MRIs, subspecialists available to be at the bedside within 30 minutes. We have the requirement of in-house trauma surgeons. So there's a trauma surgeon in this hospital 24/7. We have to do outreach, injury prevention. We have to have a robust research program. The involvement that I and we have on the local, state, and federal level for disaster management and injury prevention outreach.
Becoming a Level 1 trauma center isn't something that happens overnight. It can take many years. You have to be accredited by several different organizations. What's the process?
So it is a complicated process. In the state of Florida, we only have Level 1 and Level 2 trauma centers. The state of Florida designates trauma centers, the Florida Department of Health. In addition to that, if you want to be nationally recognized and also tell the world that you adhere to all the national regulations, you get accredited or verified by the American College of Surgeons. And so here at Orlando Health, we have both. The designation from the Department of Health as well as the verification from the American College of Surgeons.
You are a Navy veteran, you are a commander, you were a war surgeon, for lack of a better term. You were in Afghanistan, you were in Iraq, and there are lots of people on your team that bring unique, really valuable skills. What's the team dynamic like in the Level 1 Trauma Center?
The great thing about a Level 1 Trauma Center is it is a center. Literally everybody from environmental services that cleans up our trauma messes to the chaplains, to the nurses, to the doctors, to the respiratory, everybody is so laser focused on the care of the trauma patient. I wouldn't trade this team for anything in the world, and if I was an injured patient, I wouldn't want to be anyplace but.
If you would like more information, you can visit orlandohealth.com/trauma.